What if I told you that there was a plant that could treat seizures, anxiety, chronic pain, and cancer, just to name a few? Well, it may seem absurd that one plant can do so much, but it's true. So today I will be informing you of how CBD, or cannabidiol, can treat so many illnesses. I will discuss how CBD interacts with the brain, its health benefits, and how it compares to pharmaceuticals. So to begin, I will give a brief explanation of how CBD works and interacts in your body. According to ASAP Science, inside of your body is a system called the endocannabinoid system. It affects your mood, appetite, memory, and pain receptors. Inside your endocannabinoid system is a receptor called the CB1 receptor. These receptors are affected by a neurotransmitter called anandamide. This is released after running and is what produces a runner's high. Anandamide also controls the production of pleasure, motivation, and appetite. And because THC's structure is so similar to anandamide, it's able to fit into these CB1 receptors, and that's what causes you to feel high. CBD, however, because the structure is different from THC, it does not fit into the CB1 receptors. So, in other words, it doesn't get you high like THC does. However, CBD can still bind to other areas in the endocannabinoid system, affecting you in different ways. Now that you know how CBD works, I will explain what it can do and what it can treat. So for starters, CBD is beneficial for those who suffer. According to White, in a 2018 study, researchers found that CBD increased the number of patients with a 50% or more reduction in their seizures. The CBD was administered to these seizure patients determined on their weight. CBD can also be used to treat anxiety. However, scientists speculate that in order to treat anxiety, CBD, a set dosage is required, not determined on your weight like a seizure patient. In a recent public speaking study, researchers found that 600 milligrams of CBD significantly reduced VAMS anxiety. According to parinc.com, VAMS is the measure of 8 specific moods: afraid, confused, sad, angry, energetic, tired, happy, and tense. In the same study, some patients were given a placebo. Those who received CBD showed a significant improvement compared to those who were given the placebo. This study also taught scientists that pre-medicating with 300 milligrams of CBD was extremely beneficial and reduced anxiety while public speaking. According to Kabbalah, CBD oil can be used to treat insomnia and anxiety in children with PTSD, a task that is usually quite a challenging feat. However, with CBD, it can be accomplished. In addition to treating anxiety, CBD can also be used to alleviate pain. According to Kabbalah, cannabis has been used to treat pain as far back as 2900 BC. More recently, scientists have discovered that it is certain components within cannabis that are actually responsible to treat pain, CBD being one of them. Studies show that CBD may help reduce pain by impacting the endocannabinoid receptor activity, reducing inflammation, and interacting with neurotransmitters. According to human studies, the combination of THC and CBD can be effective in treating pain related to multiple sclerosis and arthritis. Kabbalah also states that CBD may help to reduce symptoms and side effects of cancer, some examples being nausea, vomiting, and pain. Test tube animal studies have found that CBD demonstrates anti-tumor and anti-cancer effects in animals by preventing the spread of breast, prostate, brain, colon, and lung cancer. In addition, one test tube study found that concentrated CBD induced cell death in human breast cancer cells. Another study done with mice showed that CBD inhibited the spread of aggressive breast cancer cells. So now that you know the benefits of CBD, you're probably wondering what the downsides are. So I will now explain the possible side effects and interactions. According to WebMD, the potential side effects are dry mouth, low blood pressure, lightheadedness, and drowsiness. A less common side effect is signs of liver injury. So due to this, patients with liver disease may need to take a lower dosage of CBD as compared to a healthy patient. According to White, CBD can cause elevated liver function tests as well. In addition, some early research suggests that taking high doses of CBD may make muscle movements and tremors worse in people with Parkinson's disease. Pregnant and nursing women are advised to avoid CBD as it can be contaminated with other ingredients that could be harmful to a fetus or infant. Now, to compare CBD and its side effects to the side effects of pharmaceuticals. Anxiety and depression are typically treated with drugs that can cause drowsiness, insomnia, headaches, etc. The list goes on. They have the potential to become addictive. To treat chronic or severe pain, opioids are often prescribed. Opioids are highly addictive and oftentimes lead users to seek out something to fill the void when their prescription runs out, and oftentimes they turn to heroin. According to the National Institute on Drug Abuse, about 80% of people who use heroin first misused their prescription opioids. All in all, CBD is a less risky alternative to many of the prescribed drugs out there today, and it can be beneficial to many groups of people. CBD is a chemical compound that provides a cure for pain and disease. Its pros significantly outweigh its cons, and it has far less severe risks compared to prescription drug alternatives. Thanks to CBD, those who struggle with chronic pain or mental illnesses can find relief through this miracle plant.